Hi, welcome back to my channel, Mental Health with Melissa. I'm Melissa. If you're new here, please don't forget to hit that like and subscribe button for more content like this as I post new videos every single Sunday and Wednesday. Subscribing to my channel really helps me get mental health information out there to our communities of color, which really helps further break down that stigma, and also tons of LCSW test prep for those that are studying to become licensed clinical social workers, and information in general to those that are interested in the mental health fields. This is a real passion of mine. So today what we're going to be talking about are the different professions in social work, really different social work careers. And I thought that this was going to be a really important video and information to get out there because really at the end of the day, the field of social work is extremely broad. There's so much to do in social work. And really, if you're not familiar with social work, or if you look at the media or entertainment, social work has a label and it can be seen as a very specific, just one label type of profession where social workers are seen to come in the home and take children away from the homes. But we're going to break that down today because there's so many different types of professionals within social work and specific job titles. So let's go ahead and get started. So before we do get started, I want you to take a look at your own personal interests and think about what and you uh, why you want to become a social worker, what things you're interested in doing, what things you're not interested in doing, what your strengths are, what are some of your limitations. Because at the end of the day, we're all humanitarians here, and we want to make sure that we're providing excellent care to our clients. So let's go ahead and get started. The first social work profession that we're going to be talking about is school social work. So, in this particular career field, you're going to be either in the elementary school, middle school, or high school, whether it be in the public, private, or technical sector. And the role of a school social worker is to really collaborate with teachers and other school administrators to make sure that you're really making the students have the best type of um, learning environment. So this can include counseling to students. This can include collaborating with the parents and even sometimes providing therapy to the parents. And when I was a psychiatric social work intern under LAUSD, I also did group therapy. So I did group therapy to middle school students that were dealing with anger management issues. So this field is very broad in itself. Social work is broad, but if we're looking specifically at school social work, there's so much to do in school social work. So definitely something to keep in mind. The next type of social work profession we're going to talk about is probably, again, like I mentioned, one of the ones that is most known to society, which is work with children and families. So the Department of Children and Family Services, or DCFS, is a pretty well-known program where you ultimately want to focus on reunifying families and working with children and their parents to ultimately make sure that the children are safe and the parents are getting what they need to hopefully bring the families back together. Besides DCFS, this can also look like a family service agency. So maybe a nonprofit where you may be providing some sort of family therapy in that arena. The next social work profession we're going to be taking a look at is policy development and research. So, an example of this may be a nonprofit organization that hires a social worker to really evaluate a program for low income clients and really taking a look at their access to healthcare or other resources and making sure that the policies are in place for this specific program. And in addition to that, there's research as well. So you may want to do more macro work. And I've talked about this in a different video, which I'll link down below, but in macro work, you're really working at a organization level or taking a look at statistics to see what is really working for a special population, what's not working, and what can be done to intervene. So you can always do research alongside other mental health or behavioral health professionals, such as psychologists, psychiatrists, or any of those professions that also do a lot of research. The next profession that we're going to be talking about is advocacy and social justice. So this is actually a huge area for social workers. So an example of this is working as a social worker in the Department of Justice with incarcerated individuals. So say you work at a major prison system and you provide therapy for incarcerated individuals there, or you really help develop programs within that system. Or you work with those that have recently been released from prison, and you help them in reintegrating back into the system or into society by helping them get set up with jobs or helping them get connected back to their loved ones. Another social work profession is community organization and case management. So social work is really based on the principles of being there as a support system to those populations that we're helping. So an example of this is working with a homeless population and being the case manager for those that need to get their Section 8 voucher by assisting them with identifying the paperwork that they need and helping them retrieve that paperwork, and working specifically with that population and that community to get them more access to resources. Another profession in social work is addiction counseling. So I worked as a substance use disorder therapist before, and what that really comprises of is providing more therapy, whether it be individual or group therapy or referrals based on what it is that the clients need. So in addiction counseling, social workers can work in a treatment center and really provide, again, that one-on-one substance abuse counseling, or work at an addiction center and provide referrals to those that are hoping to get more information about different types of 12-step meetings that are available or other types of addiction resources. Another really big social work profession is medical social work. So medical social work is a type of social work where you're working in the healthcare field, and there's several types of social work professions available in medical social work. So first is the hospital setting, and I worked as a inpatient hospital social worker, and really the role of the social worker there is to do discharge planning and resource providing and short-term crisis intervention. So in my role there, for example, you work with the interdisciplinary team, and when the medical provider would tell me that a patient is ready for discharge, however, needs a skilled nursing facility, I would really work with the team and the patient in referring them to the appropriate level of care that the medical team recommended, in that case, a skilled nursing facility. Another example of medical social work is an outpatient primary care clinic. So that's actually one of my jobs right now. I work as an outpatient primary care social worker or behavioral health provider. And that's somebody that works closely with the PCP or the primary care provider in helping a patient get some access to immediate needs. So I do a lot of needs assessments depending on what it is that the patient needs, whether it be food referrals or housing, emergency housing, to crisis counseling. And another type of medical social work is hospice. So I worked in hospice years ago, about 9 or 10 years ago, and you go to people's homes that are at the later stages of their life and provide end-of-life counseling to the patients, bereavement counseling to the family members, and resource coordination in terms of helping with funeral arrangements or cremation arrangements. Then we have private practice or consulting and therapy. So I have a private practice that I own. And what I really like about that is that it really allows me to use the business side of my mind. And when social workers go into social work school, we're not really told about the business side of things. We're more focused on the nonprofit humanitarian side of things. But really, you can open up your own business in private practice for therapy. And that can include a lot of things. So you can provide therapy and other organizations actually can reach out to you and you can provide consulting for them. For example, there's a dialysis organization that I work with that reaches out to me and I provide consulting to them about what types of literature is out there that's appropriate for grief and bereavement. And in addition to that, I provide contract services to other organizations that need therapy for their staff or for any of their clients. And so, again, it's that business side of things, and you can still provide that humanitarian aspect as well. And then we have military social work. So, military social work is pretty popular actually. So, there's the Department of Veteran Affairs. And so, the Department of Veteran Affairs is an organization for those that have served in the military and are military service veterans. And as a VA, a social worker, you can provide so many different types of services. You can be a therapist in the VA, you can be a case manager within the VA, or if you decide to work for the DoD, you can actually work with military service people that are active duty and their family and be a military therapist, basically. Lastly, is teaching and mentorship. So, as a licensed clinical social worker, you can be a clinical supervisor. So I'm a clinical supervisor. And what that entails is having your license for over 2 years, taking the appropriate training in CEUs, and then you're able to provide supervision hours to associate social workers that eventually want to become LCSWs themselves. And this is really a rewarding part of the profession because you're able to do teaching and provide that same sort of supervision that you were able to get when you were an associate social worker yourself. And in addition to that, you can also become a professor if you want to work at a local community college. I believe all you need is an LCSW to be a professor at a community college. If you decide to do higher academia teaching, such as being a professor, believe that in most universities that requires a doctorate, and you can get a doctorate in social work or a doctorate in another mental health profession. So I'm going back to school right now to get my doctorate degree in psychology, and so hopefully I'll be able to do higher academia teaching. So there are tons more social work professions out there. I wasn't able to get through all of them today, but please definitely, and if you have any questions, leave them in the comment section below. If there's anything that I left out, please leave that in the comment section below. I really enjoyed doing this video. If you'd like to see another video with similar information, then I'll be happy to do that. Thank you so much for watching. Please, again, don't forget to hit that like and subscribe button for more videos like this. Until next time, managing mental health matters.